I'm Dominic DelliCarpini. I'm Dean of our York College Center for Community Engagement. And one of the many things we try to do in the community, and probably one of the most important things, is actually to monitor and study public policy. And Vinny will be talking to you a little bit about that now. Of course, in the current environment we live and with the opportunities we now have for some real social change, we're really excited to be able to offer this webinar today to talk with all of you as members of the public and some members of our faculty about some things that we might do in collaboration with our city. I'm really thrilled that Commissioner Robinson has agreed to join us today. He will be our special guest, and most of the time will be spent hearing from him a little bit about how the New York City Police is taking some really active steps, I think, to be able to move forward with a positive and really useful approach to policing, and we're all looking forward to hearing that. I'll just say first that the way we'll run this webinar will be that we'll hear from Vinny briefly, and then Commissioner Robinson will talk to us a little bit about some of the things going on in New York City. Along the way, I encourage you to use the chat function on the Zoom to be able to start asking questions as they come up. Don't feel like you need to wait till the question and answer at the end. And in order to keep this organized and make sure we get to as many questions as possible, I'll be monitoring the chat function. I'll be keeping track of the questions. And after Commissioner Robinson has done his remarks, then I will start bringing questions to him or to Vinny or to both of them to have conversation about. So feel free to start chatting whenever you would like to. So with that, I want to turn it over to Vinny. Vinny is the director of the Arthur J. Glatfelter Institute for Public Policy. And through his work and with a team of faculty members and students, both graduate and undergraduates, he tackles some of the biggest policy challenges that are impacting the greater York community today. Through rigorous, unbiased research, analysis, and policy development, the Glatfelter Institute plays a vital role in informing community conversations and policy work, as well as supporting ongoing community efforts to produce equitable and sustainable change. So now I'll turn it over to Vinny.
Thanks, Dominic. So thanks, Dominic. Again, yeah, the Glatfelter Institute, we do a lot of research with government, with community organizations, to really begin to understand what is going on in the greater York community. And when we're thinking about why we're here today, the role of the Institute is really clear. It's our responsibility to provide really careful and thoughtful review of past public policies and programs and determine any inequitable outcomes as a result of them. We really we use data-driven research to guide current policymakers in developing and administrating more just and, to an extent, really, frankly, less racist policies. And it's our responsibility to educate our future leaders and policymakers on both the theoretical and practical aspects of democratic policymaking. So with that, I'm going to have a quick plug for the Masters of Public Policy Administration program. So I'm the director of the Institute. I'm also the director of our master's program, which is really geared towards educating our future leaders and thought makers and policymakers related to public policy and public administration. So we have both that theoretical background, but then also the practical understanding of what needs to be done for good policy to occur. I thought it would be useful to really dive in a little bit about what is public policy. And I want to start out going back a bit. So this is an approach to policy analysis, to analysis of the political system by David Easton. It's beginning to look and figure out how do we take all this information, all of our policies, the context that we're going in and what we put in and what churns out. So we start with our large environment. This is everything that's going on. And we begin to have our inputs, our demands, and our supports that go into our political system. And that is, our typical idea of people debating it out on the floors of Congress, the deals being made that is coming to our policies or our decisions, and then finally our outputs, and then circling back to our demands. I want to throw this out there because it provides us a really good indication and a really good starting point of how policies are made. right? They don't just pop out of nowhere. And it isn't just someone sitting in a room by themselves saying, you know, I think this would be important. This would be a really interesting policy to be working on. But it is really the environment, that's the cultural, the social, the economic environments that we're working in, that places these demands on our political system and our policymakers to have some type of action. With that, we get to this idea of the policymaking process. And this is really laid out by John Kingdon, who's one of really the most important figures in the study of public policy. So he talks about how we have to set the agenda, we begin to identify alternatives and select solutions, and then begin our implementation. But this is really taking what is important to the government, people outside the government that are associated, anyone paying attention, what is important? What are those different problems that need attention and need a response? And it's the role of setting the agenda to narrow down this list to something that actually is going to receive attention. And it's not everything, right? We all have things that are important to each of us, but at some point, something will happen, maybe from the outside, maybe from the inside, that will merit a decision that something will occur. From there, we begin to look at what are the alternatives, right? What are the things that the government should seriously be considering to solve whatever challenge we're dealing with. This is done by experts that are generating alternatives, but it's also done a lot of times, and I think nowadays, by community members and by community organizations. We go through the analysis process and select the solutions, then we finally get to the actual implementation and administration of whatever that policy is. So there's a couple of key components to policy. And one of the most important, that it's a response to some sort of problem or innovation or issue that requires attention. And it's made on the public's behalf. It is something that is not just, something at your college, that it's just dealing with people at your college, but it is for everyone. And it is the government or a government agency that has the capacity and the weight of really the police behind them to enforce these policies. And it's made on the public's behalf, meaning that it is for the public at large. And again, it's oriented towards a goal. It's oriented towards this desired state that addresses this issue, this problem, or this innovation. So who creates policies? We all can think of some pretty easy examples, but laws and regulations, right? Policies can be legislative, they can be regulatory, they can be judicial, they can be administrative. They're done at the federal level, the state level, the local level, the organizational level. But it's important to remember that not all public policy is legislated and codified. I think some of the things we'll be talking about today is like through the police department, that not all policies that are in all police departments go through city councils, right? They are things that are internal policies that have this really important impact on the general public and on our lives day to day. It's also important that the lack of any specific statement and the lack of any particular action is also considered policy action and is also considered public policy. So if we have an elected official that decides not to take an action, that is a policy statement in and of itself that is important to consider and think about what are the implications of those. So then why are we here? Traditionally, public policy has been about power. Right? It's the competition for power, and it's really the competition to control the mechanisms of those sanctions and rewards that creates policy. What public policies do is bundle these rewards and sanctions together and directs them towards specific individuals or organizations that the policy is geared towards. So traditionally, there's been gatekeepers. So this could be based on race or ethnicity or socioeconomics or gender or political influence, and this list goes on, and it's kept some people in and some people out of the process. But we're beginning to see a shift. So everyone, this is residents, organizers, we are all beginning to see in communities that everyday people are beginning to organize for change within their communities. We see people demanding action, and that action is being realized and really fulfilled through policy choices and through policy changes. This leads us to this democratic policy making. It's the ideals of justice and public and civic participation and authenticity that really matter in this type of policy environment. So taking all of that, what do we do, right? How do we create good policies? So I broke this into 3 areas. And the first is looking at the historical perspective. How do we make good policies, right? It doesn't just come out of nowhere, and it's not an easy process. We need to look at our past and figure out what has worked and what has not. But I think more importantly is why. This could be through case studies, it could be through program evaluations, and I think it's also through asking ourselves, are the ends that we've achieved in line with the values and standards of today? Should we repeat what has already been done, or is it time to try something new because what has happened in the past doesn't align with where we're going now? The second idea is taking this really rigorous and theoretical approach to policymaking. It's really important to understand what makes a good policy and how do we get there, right? Do we have the infrastructure to get it done? Do we have the people power to get it done? Are the resources available to achieve this goal? Are there unintended consequences that will make things worse than what we're at now? And I think the last idea, and I feel like this is one of the most important, is that we all matter in this process. There's a community-driven perspective to create good public policy. A good friend of mine once told me that a policy on the shelf is as good as no policy at all. And that means that we need to craft our public sphere and our public policies to reflect the needs and the demands of our current times. But more importantly, if the target population of any specific policy that it does not adopt it, right? They don't want to do it. They're not going to be listening to it. Does it matter that it's even written? We need to really be thinking through public policies that consider the people that are going to be directly impacted by it and the people that are going to be utilizing it and living through it every day to really get to a point where our policies matter. So as a community, as a state, as a country, as a world, we're all reeling with the effects of these most recent acts of police violence. As an institute, we've fully acknowledged the historical and the racist motives leading to the deaths of thousands of unarmed Black and brown people throughout the country. And what we've seen over the past few weeks is an attempt to right these wrongs of the historically unjust public policies and programs and the administration of these programs. Elected officials and governments are working day in and day out to figure out what they can do to address these issues now. And really with that, I'm proud to present Osborne, Mo Robinson III. Commissioner Robinson is the newly appointed police commissioner for the City of York Police Department. Prior to coming to York, Mo served as the deputy police chief for the Reading Police Department. His responsibilities included implementing the violent crime reduction measures, strategic planning, as well as assisting the police chief in the day-to-day operations for the Reading Police Department. Commissioner Robinson began his law enforcement career in Baltimore City and served for 25 years before retiring in 2018 with Baltimore. During his tenure with the Baltimore Police Department, he served in various assignments such as the Northern District Patrol, Violent Crimes Task Force, the Eastern District Special Narcotics Initiative, Criminal Intelligence Section, Walbrook High School as a police instructor, the Crime Analysis Division of Human Resources. He's held command positions at the Executive Office in the Northeastern District, Commander of the Western District, Area Commander for the Chief of Patrol Division, Chief of Patrol, and lastly, Chief of Inspectional Services and Integrity Division. Commissioner Robinson was born in Baltimore. He received his education from the Baltimore City school system. He's a graduate from Northern High School, and he attended Salisbury University, where he got his BA in Communication Arts. He's also an Army veteran and is a graduate of the Army Officers Cadet School for Leadership. He comes from a family of police officers with an older sibling and cousin, both being captains in the Baltimore Police Department. And with that, I'd like to turn it over to Commissioner Robinson.
So good afternoon, everyone. I thank you, Vinny and Dominic and Pat, for the opportunity, and I appreciate you all hosting this event for such an important topic. And really, it's about the zeitgeist. It's a sign of the times, and so we're at a moment in time where policy is very important. The voices of the community are loud, boisterous, and with the intent to be heard, and we have an opportunity to make things better, refine policy, modify policy, so that it is more congruent with the times as we are today in modern policing and modern policing practices. And that should all today be predicated on humanity. So I know that there were a couple of questions that came up for the panel. So I will take a shot at, I think, the first one. The question is, if policies are designed for the public, should there and would there be some consideration for interpreting what these policies mean to individuals in terms that they can understand and that is relevant to them in understanding the importance and its impact? Simple language, explanations that keep people in the process because they understand. I want to respond to that because that is a great question. And actually, I think it is a statement. And this is a question that sort of came up for me when we decided to put our use of force policy on the city's website. And when we had our directors meeting on Monday, there was a bit of disbelief that no one had sort of responded or commented about the use of force policy. And the statement that I actually made is, well, it's kind of difficult to read, right? I mean, even for police officers, even for a lawyer, you have to go through this sort of long document. And while you have a policy, it's also predicated on an officer's legal authority. And so the layman, the everyday person would find it difficult to understand. And so I think that not only do we have to be able to publish these things, but we also need to be able to have conversations in the form of town halls. Now, given that the conditions of our environment in COVID-19, Zoom meetings and things like that, to bring some clarity about that particular policy and other policies, because so many policies, specifically with police departments, not just here in Europe, but nationally, are predicated on law, which is sometimes difficult to interpret.
I think that's so true, Mo. And we see so often that policies are written in a way by the experts, right? So there's the jargon in it that if you're not familiar with it, that you're not going to understand it, and it makes it even more difficult for the people that need to understand it. So for even like the use of force, the police officers that need to know when they can use deadly force, if they can't clearly understand it, how are they supposed to work with it and work within those boundaries and guidelines? Outside of policing, I have a friend that works for the Center for Medicaid and Medicare Services, and she was tasked with interpreting a policy that there were so many acronyms and loopholes, and it was her job to understand it, and she couldn't follow it, which is one of the big issues with our policies in general. They should be written in a way that anyone can understand it, that it's easily interpreted, and that we can all really get to that end goal and that end point without struggling and needing to have 5, 6, 7 degrees to read and understand what's actually going on.
And the one thing that I'll add as it pertains to police officers and the use of force, the training that they receive is different than someone in the public just reading a policy. They actually receive training that corresponds with the policy and to the policy in a sort of line by line model, so that they understand. And I'll use the example of the use of force because it's public at this point. But with that policy, there is specific training that they get in understanding each level of force and the use of force continuum and the conditions, and providing examples of what it exactly means. So it's not just about providing the policy and having them read it and then everyone is left to interpret it on its own. That's not the manner in which they're trained.
That's good. Yeah, that's great. And I think we all need to really follow that model, so we can all understand what these policies mean. I have a question for you, Mo. What was the process like in developing the use of force policy? And did you get any pushback from inside the police department?
So what I'll tell you is, first and foremost, this policy was developed before I came. I've only been here since October, and I actually took over in January. The original policy was produced in 2014. It was revised in 2018. And then what you see in 2018 with the use of force continuum, that is consistent with sort of the modern police practices is what you see. So I believe that I didn't talk to the panelists about this, but I did speak to the panelists about this, but not the attendees, but the pledge of 8 can't wait. Mm-hmm. And so those were those particular tenets of use of force were a push through the 21st century policing model that came under former President Obama. And so what you see in that policy that came out, the modification of that policy in 18, were the standards that were most consistent with the recommendations as outlined in the 21st century policing. Of the 8, there were only 2 that don't exist as within our policy right now. One was the duty to intervene, which we're in the process of adding that, and we're just going through the proper language so that it captures what we needed to capture. And that duty to intervene is really about telling an officer straightforward and point blank that he or she has an obligation to intervene if they observe an officer operating outside of law or outside of policy. So it is a direct reflection of the voices that we hear about the blue code or the code of silence within police departments. And so prior to this guidance that sort of came out under the 21st century policing, that wasn't something that you really saw in policy within police departments. As a result of that, it made it clear that if there is evidence that an officer knew of information about an officer operating either outside of policy or outside of law and didn't intervene, then they too could be held accountable by policy. And so the other one is the mechanism of tracking comprehensively uses of force. And so while we had not addressed that policy, we have taken steps to capture it. So when I came here, there was really nothing in place to capture uses of force other than local sort of discipline folders kept by an immediate supervisor. And then if something rose to the level of being investigated by the inspector would have those documents. But if, say, you wanted to determine at time for promotion what type of internal affairs background an officer had, what type of use of force background an officer may have had during their tenure, how many crashes they've been in, there was no one place to comprehensively look. And so under my leadership, we purchased the software to capture those things so that we can actually not only know the information, but also use it to identify what I would refer to as frequent flyers. So it would produce reports that tell us Officer Jane or John Doe, this is their second use of force within this time period. And that gives us an opportunity to say, well, maybe we need to have an intervention to address maybe some other issue that may be going on, which is huge. But we're still in the implementation process for that.
One of the things that you're both raising is the idea of the fact that the public needs to understand. I think some of the protests all around the nation are suggesting that people feel the need to be heard because they don't feel like they're involved in the process. And we've got a couple of questions that are related to each other that you might address. And that is, one is, how does this relate to the concept of community policing? A few people have talked about community policing. And then there's also a question about, is it possible to hold forums or, some sort of town hall meetings where giving people a better understanding of what these policies are, since they are so difficult to read.
And so with regard to community policing is huge in policing, but specifically in reducing crime. And it has both an indirect and a direct impact on how successful we are, as it supplements operational and enforcement tactics that are used by police departments. So indirectly, we talk about the perception of crime. And so if you're in a community where the community has a poor perception of its police officers for any number of reasons, it could be because they feel like they're too excessive, they don't know how to talk to people. It could be they're not responsive. It could be for any number of reasons. What is it that we do to address those issues to change the perceptions? Because even if that isn't true, if that's what people believe, because that's what people hear, or that's what people see, then we have to do a better job of addressing it. And one of the things that I am take a lot of pride in is my approach to policing as a brand. Your organization, your police department as a brand. So in the same way that businesses outside of this industry market themselves, police departments need to do it the same way. Because in as much as we deserve a portion of the narrative that we get, we have to also do a better job of showing the other side of what we do well, right? The things that we do to engage the community so that there is a balance sort of there. When people have a different perception, they're more willing to talk to you. And so about crime, about things that are going on in neighborhoods in terms of quality of life. And so as a result, you can become more effective in the crime fight because you're getting information more readily.
And do you think there is a lack of understanding of the role of police officers and the role in the community that could be corrected by things like town hall meetings and other ways to kind of directly engage the public in the understanding of the policies that you use?
I think that there can be a lack of understanding sometimes, but I don't want to put that out as a generalization. We definitely would need some context to that. And but there is a reality that a person's perception is their reality. And I think what's important for us to take away in the policing industry is that each encounter is an opportunity, and an opportunity to show who we are, what we want people to see us as, and not sort of these coined phrase, officers have integrity, officers are professional. We have to live those things, and each encounter has to be that way if we want that to be perceived as our character and not be taken at conduct, because there's a difference between character and conduct.
Thank you. I think there's also a sense that, this is a great opportunity, but there's also this fear that it's a moment that will pass. And one of the questions that I have is, this is not the first time police reform has been in the spotlight. Can either of you discuss successful past police reforms or or policy changes that maybe had unintended negative consequences at moments like this?
You want me to take that one?
Sure. Yeah. If you want to start, I'll follow you, Mo.
So a part of my reality when I start hearing reform. I start hearing, especially today, given the current climate, the defunding and the dismantling and new legislation. There's a reality for me, which is being in this industry for as long as I have. In most cases, there is policy, standard operating procedures, and law that already governs the behavior. The issue is leadership and holding people accountable to what already exists. Because creating new policy to try to greater spell out something that is either not being enforced appropriately doesn't change the real issue. And so I think more often than not, it's not about the policy or lack of policy. It's about how either in a moment in time or culturally within different police departments, behavior is allowed and people aren't held accountable.
I think that's so true, and I think what you were saying before about the interpretation and how people view the police really leads to that. One that came to my mind was stop and frisk, and I think especially in New York City, we see that stop and frisk had very disparate outcomes. Maybe I don't know enough, but maybe it had the effects that the policy intended, that it reduced crimes or what have you. But there were so many other issues going on that didn't align with the cultural, the social values and norms of the community, that it also creates this view and fear of the police that is detrimental to other policies. So even if it's the perfect policy, if it's viewed in a negative light, and if people are very reticent about it, it's not the perfect policy, right? A good policy is not one made in a vacuum that doesn't consider everything else, but it's one that it's made in a practical sense that takes into account what could those potential unintended consequences be? How do we mitigate those unintended consequences? And does it align with the direction that we want to be going in?
Here's another question, and I think it's related to what we've been discussing. So we're hearing calls to defund the police, but really when you dig down on that, what those calls oftentimes amount to is actually changing funding for other kinds of things that might prevent crime. And the question is, are there ways in which the York City Police Department partners with other types of professionals or agencies, such as social workers, psychologists, homeless shelters, addiction specialists, etc., to address specific situations? If so, how have those partnerships impacted the responses to those situations?
So we do partner with a lot of folks, but those partnerships are not in a place where they could be. And so what I mean by that is we have relationships in the community with external stakeholders that allow us to tap into those resources to address an instant or an incident as they come up. Most of those partnerships operate as their own entity with their own mission, and it's not necessarily merged with the police department. And so one of the things that this current climate and current conversations and the idea of defunding we have to really think about, but we have to do so intelligently, is are there things that police officers respond to on a daily basis, multiple times a day, that police officers really isn't the best resource to use for? And so if that is the case, governments and communities, maybe we need to start thinking differently about how we use police officers, because how police officers have been used has grown exponentially over the years. And so even with the whole advent of call centers and officers having radios, you see year after year that the call volume increases. And so you hear people saying, well, what happened to Officer Friendly? What happened to officers being at this outpost? Well, when the authorized strength of police departments haven't really changed much, but the number of calls that they have to respond to has changed exponentially, those more proactive and positions that wouldn't be responding to calls because they would be engaging people, now those officers are out responding to calls for service. And so if we want to really free up officers, we have to really look at the number of calls that officers shouldn't or probably aren't the best person to respond to that type of incident. And there are a number of them that's out there.
And I think that goes back to that theoretical idea of creating policies and administering them, because if the resources aren't available and if it's not, if policies aren't continuously revamped and rethought and the consideration is placed on the resources available, you could be placed in a situation where you just can't meet the needs. You can't meet the capacity. You may want to, but it's just impossible to do it. And if there isn't the flexibility and the re-analysis of what's going on, you can get into a place where you just end up being stuck.
Another question for Commissioner Robinson. Some research shows that police officers are more likely to engage in excessive force immediately following an especially stressful call. Is there any period for a police officer to decompress after a domestic abuse call, for example? What local resources are available to officers for their own mental health?
So that's a very good question. So the direct answer in terms of a policy or something that would require an officer to decompress after a call, that doesn't exist in York City Police Department, nor in the two other police departments that I've worked for, at least that I'm aware of, unless something has changed since my exit. However, the manner in which a lot of those calls occur and the reporting that kind of goes with that officer handling that type of call, that officer typically doesn't end up responding immediately to another call because he has to process the report and or the arrest that corresponds with that type of call. And that's where the decompression period comes in. What was the second part of that question?
It was whether or not there are mental health facilities or mental health services available to the police officers.
So the answer to that is yes. The issue is culturally within police departments, it is taboo for an officer to sort of seek out those services. So one of the things that we are talking about as a result of these conversations that we're having is increasing the number of times that officers have to be evaluated by psychological professionals. So as it stands right now, the only time an officer is evaluated by a psychological professional is for hiring, unless that officer is involved in a deadly force situation, then it's required, or the officer does so voluntarily. And so the example that the attendee brought up was about decompressing after a single call, right? But officers are dealing with everybody else's trauma every day over a period of time. So really that same stress isn't really about a single call. It is about the culture that the officer is involved in a daily basis. And that doesn't even include his or her home life.
Yeah, and related to that, one question we had was, at what level policy should be created? Obviously, we're dealing not only with your responsibilities for York City, but you're also dealing with a national context and a lot of things going on. Should there, do you believe, be policies at the state and federal level to better assist you in the work you're trying to do here in the city?
say that one. I missed the end of that.
I think the question is, you know, should things be more standardized at the county, state, or federal level to be effective for the work you're trying to do here?
I think that it can be. It depends on what you're referring to. So I think that there's an opportunity for use of force standards to be standard, but that doesn't mean that there's an opportunity for all policies to be standard, because every community has its own sort of idiosyncratic way, and what may be good for one may not necessarily be good for another.
Yeah, and along those lines, Commissioner, one of our participants had asked if there's specific language that prompts action, as in the duty to intervene. What is told to officers, say, in these circumstances, that you are responsible to intervene and how to intervene?
So we don't have that duty to intervene policy. That's what we're actually looking at. There's several departments that do have that policy, and what we're doing in the present is assessing what's best out there as it applies to York City.
Another participant had asked the question, you know, Commissioner, if you could give some examples where police are called to quote unquote incidents that aren't really under their jurisdiction.
So jurisdiction probably isn't the best term, because they currently are under our jurisdiction. But ultimately, this is what I'm saying. Police officers are responding as first responders to mental health calls for service, fire calls for service, overdose calls for service. And so the question becomes, are we the best person to respond to that situation as the first responder? Maybe in some cases, depending if there is violence or something outlined in the text of the call for service. But one of the things that is challenging in our career is, over the years, there's this idea that we can just give officers training. So we can give them the critical incident training, because now they know how to deal with everyone that's under mental health in a mental health crisis. We can give them training in how to administer Narcan. So now they know how to deal with all overdoses and the personalities that they have to deal with during the overdose when they bring people back. And that's just not true, because there's a reality, right? What happens is we train officers to be these great generalists in everything else except the fighting crime laws, enforcing laws, enforcing ordinances and things like that. So they become generalists. And so what does training look like for a police officer to deal with someone in a mental health crisis? Well, if you're going to give officers training, typically it's going to look like an 8 or 16-hour block of training, sometimes a 24-hour block or a 40-hour block of training. And that training is typically given once, sometimes every year, sometimes every other year. But then you look at the number of times they go to those that specific type of call for service, or that specific type of mental health crisis. They can vary in every situation. And so we have people that receive specialized training. They do those same type of things on a daily basis, all day as a practice, and that's why they are called specialists. But when an officer responds there's an expectation that the officer is going to perform that task in the same way that a specialist would, but that specialist deals with that type of thing every single day, versus the officer dealing with it on a case by case, and every case may not look the same to the officer. And so I think there's just an opportunity for us to at least assess and examine whether or not it's a better way for us to do business.
Great. Here's another question from a participant. When you have multiple departments operating in a single geographic area, how does policy impact the officer's actions? For example, county sheriffs operate in the city of York. Are they held to the same standards as the York City Police?
So that goes back to the question of should some policies be standardized? And I think that can be an issue when you have many departments in a small geographic area. You also, in policy, you have to look at the organization's mission. The sheriffs don't have the same mission as a municipal police department. And so their policies are going to vary and be different than ours in some instances.
I could also see an issue with the overlap and the confusion between the sheriff's office and the York City Police Department, because if there is not the consistency in policy, so if I'm not sure, but if the sheriff's department doesn't have a use of force policy consistent with the city's use of force policy, and some incident does occur, it occurs in the city, and the city police are blamed for it, regardless of the city police being the perpetrators of that incident.
I have a better example for you, or equally as good example for you. When you have multi-jurisdictional task force, like the County Drug Task Force, when you look at our quick response team, they're multi-jurisdictional teams. And what the thing about those is they can be governed by SOP, but you're still taking people from individual departments. Or how about when we're beyond our capacity, which happens, and sometimes we have to call other jurisdictions to support us, and they have to they call us to support them, and we go into their areas. We're still operating under the way in which we were trained.
Right.
So all of those, that's definitely something important to consider and think about.
Commissioner, you've made it clear that you think the implementation and the leadership is really important in the in carrying out the policies. But are there policies that you think need to be altered in order to make your job more feasible?
So the answer to that is absolutely yes. Just under in this short time that I've been here, I've modified a few policies. And one of the things that I was trying to do before we went into the COVID, and then when we went into the protesting, was to look at a policy each week. And one of the other things that I had been trying to push for is a communications manager, not just from an aspect of branding, but someone who actually can consistently look at best practices in our industry and make recommendations to me. Because the reality is that most of you have seen what a general orders or policy book looks like. You know, most of them are larger than dictionaries. And so that's not something I just sit down today and I can go through every policy and modify. And unfortunately, because I can't, sometimes there is an incident that happens. And then when I have to look at the policy, I'm like, this is draconian, this is antiquated, this should have been addressed, but it hasn't. And so that's one of the challenges when you don't sort of have that those supportive elements available to you in a smaller part.
And this is both for you, Commissioner, and Vinny. Who really drives policy change? What's the role of the public in supporting important policy change?
Well, I think traditionally it's come from people that have power, the time, the influence, the money to make policy changes. But I think we've been seeing over the last few weeks, over the last few years, that when there are very significant issues that just anybody can begin to drive that change. Obviously, we need to go through official channels and government structures for policies to be codified and approved and put into place. But I think that driving force is beginning to come from the public in some instances. Yeah, I think that's all. That's all I want to say about that.
All right, we just got another question, and this relates, I think, to something you were speaking about before, Commissioner. And do you think an added policy where a mental health call, an officer could also be could have a trained professional who deals with the outcome on the call as well, that they'd partner up between the police and some mental health professionals?
I think that's it, and I think in some cases that we have to, and we definitely have to do the research, but I believe that based on my experiences, some cases the officer should be accompanying the mental health professional and not vice versa. Or in some way perhaps providing them with that dual training that they would be allowed to be in a position to protect themselves as well. And I don't have the specific answer, but what I do know is that in many cases, the limited training that we get does not translate into what is needed to diffuse some of those situations.
Thank you. I know we're running short on time. I have one more question, and that is about assessment. What evidence or data do you use or can you use to determine if policies and practice changes are effective? So once you put something into effect, and I'll put this on Vinny as well, how could things like a public policy institute help you assess the data supporting or not supporting a particular policy or policy change?
So I'll start. I think that it plays a role. I think the issue I have with answering this very directly is it may not apply for every policy. However, there are policies like use of force, like departmental crashes, like the number of uses or discourtesy complaints that someone may get. And that essentially is what I was talking about earlier in terms of software and analytics. So in purchasing this software benchmark, one of the things that I'm able to do is identify just those things. And it will specifically target those who have multiple incidents, whether it's crashes, whether it's uses of force, whether it's discourtesies. And it allows you by those persons being flagged to dig a little deeper to see if maybe this person needs to decompress. Maybe this person needs some intervention. Maybe there needs to be a different level of discipline associated to this particular person, because for whatever reason, every time this person goes to a call, it turns into a discourtesy complaint. Well, that's not normal. But if you don't have the evidence and you don't have the technology available to you to capture that, and you're doing it sort of in this antiquated way where everything is done in a paper file and it's at somebody's desk, you're not going to get to that information until it's too late.
So we'll end with this. One question was whether or not the Public Policy Institute, Vinny, could play a role in interpreting the policies into plain and consumable language. And I will say that it is the mission of the Center for Community Engagement and the Glatfelter Institute to do that kind of work. Vinny, what role do you think we can play out of the Institute to be able to support the work of Commissioner Robinson and the police force?
Yeah, I mean, I think that's those are the kinds of things that we were put into place to do. The Institute is really a community resource that's available to the commissioner, but really to anybody in general, to public officials, to community organizations that would like to develop policies or understand what's going on. And I think, we have our graduate students that are adept at being able to do some analysis and interpret policies and think through unintended consequences and so forth. So we are open to whatever role individuals need us for, or organizations and governmental agencies need us for. We're happy to fill that role and work with anybody.
And I'm going to take you up on that, because I have an idea already. So
that sounds good. Well, I look forward to it. We'll chat soon.
That's why I asked it publicly. That's all we want to play, actually. And So I know Commissioner Robinson has a hard stop at 5, so I want to thank him and Vinny for the time they've taken to do this. I want to thank all our participants for coming in and asking such good questions, and I've kept track of all of them. I think we've gotten through most of them. But I also want to invite those of you who participated to make suggestions for follow-ups. We don't want this to be a one-time thing. If there are other things that we could do out of the center or out of the Glatfelter Institute to help support the important work that Commissioner Robinson is doing and important work that's going on in the country right now, we would be more than happy to do that. So please feel free to contact Vinny or myself or Karen Schwartz about other things that you think would be useful. We know our role, right? We are not police, we are not law enforcement professionals, and we are not on-the-ground providers for social services, but we can provide research and we can provide our students with research opportunities that then make them better citizens. And that's really our role, I think, as an academic institution to support the community. So thank you all for coming today. It was really, really useful. We will have other discussions coming up on other things like housing and redlining and other kinds of policies that affect the poverty that really does drive crime and other kinds of social ills along the way. I also want to thank Amanda Rich, who's with us today. She is the director of our Institute for Social Healing. And you'll be hearing more about that institute as well, which will deal with trauma-informed care and other social ills that we hope to provide research about as well. So thanks to all for taking the time today, and we will continue to keep you informed about the progress of these things. Have a good rest of the day.
Thanks, everybody.
Thank you. Vinny, I'm going to call you.
Thanks, Mo. I'm looking forward to it.
As soon as I get in the car.
I like it. Thank you.
All right.
Thanks. Talk to everyone soon.
Thank you.
Bye.